So one part of checking heart function in a patient is checking their pulse. What I'm looking for is, do they have a fast pulse or a pulse that's too slow? The average pulse for an adult would be 60 to 100 beats per minute at rest. There are several different ways we can check a pulse. I think we all know the one. It's right under the thumb, right? 2 fingers. You want to use your 2 fingers and not your thumb, because you actually have a pulse in your thumb and you could accidentally be counting your own pulse. Again, you want to wear a watch with a second hand, and if your patient's pulse is regular, you can count it for 30 seconds and double the number. But if your patient were skipping beats, we would want to take what's called an apical pulse, and that's when we would take our stethoscope and actually listen to the heart and count for a full minute to get an accurate pulse. And some of the things I'm looking for when I'm checking for a pulse, particularly at the wrist, is it a strong pulse? Do I feel it bounding like the heartbeat really strong, or is it weak and thready? This can also indicate, is your patient dehydrated, or are they in congestive heart failure? If they were, they would be really bounding pulse, or if they were dehydrated, it might be weak and thready. Another place you can take a pulse is right here at your jugular. And there it is, nice and regular and normal.